Immunoengineering in Minutes presents Photoimmunotherapy. Doctors and scientists use all sorts of methods to treat cancer. The main ones include surgical removal, radiation, and chemotherapy, or cancer drugs. Photoimmunotherapy is a cancer treatment method that uses light to improve effectiveness of cancer drugs. How? Let's go back to what the current problem is. Healthy cells follow a cycle where they move through checkpoints before they are allowed to divide and grow. This way, our bodies make sure each cell is doing what it's supposed to do. Cells sometimes have a malfunctioning of their machinery that causes them to ignore these checkpoints, so they grow without bounds and divide uncontrollably. These cells are cancer cells, which grow rapidly and unorganized to form a tumor. Cancer drugs are put into the bloodstream so they can permeate the whole body and find and kill rapidly dividing cells, and here rises the problem. Skin, hair, bone marrow, and digestive tract cells also grow rapidly. These cancer drugs therefore greatly harm all those cells and cause awful side effects in patients. This is where photoimmunotherapy comes in. It uses a combination of two molecules to create a targeted cancer drug that only kills cells you want it to by using light as a means of giving the drug direction. Let's break this down. Molecule 1 is the immuno part of the therapy. It's a molecule that's designed to imitate our own immune cells. It finds and attaches to cells in the body that look unhealthy, for instance, ones that divide too quickly. Researchers attach molecule 1 to molecule 2. This is where the photo part of the therapy resides. This molecule does nothing normally, but when it's exposed to high-intensity light, it changes its formation and becomes an activated cell-killing molecule. The resulting molecule is the drug that researchers can now put into a patient's bloodstream. Finally, as a final step of photoimmunotherapy, light is shown in a very particular spot on the patient's body, like where a tumor is. All of drug molecules 2 in that area are activated and start killing the cells nearest it, which molecule 1 makes sure is always the rapidly dividing, unhealthy-looking cells. Now all the unhealthy cells are being killed in that lighted area, causing the tumor to shrink. Remember, this cancer drug is still put into the bloodstream to permeate the whole body. And even though molecule 1 might attach to rapidly dividing cells all over the body, molecule 2 won't kill anything because it isn't activated by light. This leaves the person's skin, hair, bone marrow, and digestive tract intact. This is just one way scientists are trying to use light to help improve cancer therapeutics.